Okay, let's have a gaze.
Let's have a bit of a feel.
Oh, that's so much better.
Feels good?
That feels the best, yeah. And I feel like I can force it.
You can almost get there, man.
Yeah, so I feel like I can force it now, whereas before I couldn't.
Yeah.
It felt like a guarded thing. So.
Yeah, there was something blocking there. With
the back was stopping the front.
G'day guys, Darcy and Aaron here. We're looking at Aaron's knee and in particular the difference between trauma and dysfunction. So when we're talking about trauma, we're thinking of things like impact, injuries, sprains, strains, breaks, those types of things. And then when we're talking about dysfunctions, we're looking at muscle imbalances, compensation, poor postures and movement imbalances. So I guess with Aaron's knee, you had trauma to it, right? You had quite a horrific injury 5 or 6 years ago. What are we looking at now?
About 8 years ago, actually.
8 years ago. So you did, what you can explain it maybe?
Oh, so I had 3 ligament ruptures. So yeah, like there was trauma there and it was acute injury in the initial stage. But now what I deal with, and it's fine, but I just have ongoing slight, in terms of lack of range of motion or just some pains that come up every now and then, and that more relates to a dysfunction that's come about because of a trauma, eh? So Darcy's going to try and, it's not acute, is it? It's just more we can get into it because it's
so what we want to have a quick look at is the difference between his left knee and his right knee, the movement patterns, and then we're going to try and see if we can retest, improve the dysfunction that's going on in this knee. Because if we look at muscle imbalances or asymmetries, there's usually an imbalance on the left and the right side. We can say one side is functional, one side is dysfunctional. So with Aaron's left knee, if you want to show us how you bring your knee to your bum, moving that towel, we can see that that heel touches all the way to the hamstring or that glute. And this side is probably at least a full knuckle in there difference. So what we're going to have a look at is treating, because you mentioned that you've got pain earlier. We're talking behind the camera. We're talking about that it feels like it's quite deep in the knee.
Yeah, I just feel like it's not really anything that's leading into the knee. I feel like it's like all the joint capsule and all the tissues that are attaching onto the knee.
Yep.
And I feel like I need like our unique MMT style flush of the actual knee rather than the kind of stereotypical treating of the tissues around it. Because when I do that, I just feel like there's just kind of this tension
locking
around the whole entire knee. It's not really one specific spot.
And look, that knee range is actually really good. Not a lot of people can bring their heel all the way to their bum. So Aaron does have good range, but we're looking at the differences between his left and his right, and saying that this one can get all the way to his bum and this one can't. So this is dysfunctional. We're going to try and improve that. It's actually really good for somebody that's had such a traumatic experience and injury, but we're just going to see if we can improve it with our MMT signature treatment, which is working on the bones, into the tendons, and giving a bit of almost like day surgery. You're sort of going in there and giving a little bit of an arthroscope with our thumbs, clearing
That's literally exactly what our knee treatment does.
Yeah. You're
it's a clean out.
It's a clean out without actually going in there with the tools that surgeons might use. Our thumbs can actually clear away those osteophytes, which are, I guess, build up of calcium that create spurs, that create little barnacles on the knee. We can get in there and actually break those off and move them, or melt them down. So I'm just starting with a nice little money spot in here, which is like a perfect part of the knee that my thumb fits. And I like to just clear and work the space through there. So it's working right next to the patella tendon. We might do one on the actual tendon, which for
really
those
therapeutic.
Yeah, it feels therapeutic, yeah. For those people with patella tendonitis, I see a lot of it with footballers, runners, those types of things, especially people that run downhill. They're loading a lot of their quad. We see patella tendonitis, and working right in here is such an easy fix for someone like us at MMT that knows that you can work on the bone and in the joint. But for other therapists, they're probably wasting their time treating the quad or treating the tib ant. They're sort of looking at what muscle attaches to it, but we're thinking, well, let's actually go into the white stuff, which is our tendons.
Yeah, there's just so much connective tissue around the knee. Like you don't realise how much actually the muscles go down and attach the knee, but just even the joint capsule itself and all the ligaments, and it's so just like there's an abundance of white tissue that needs as much blood flow as it can get. Like with tendons and ligaments and joint capsules, they're white for a reason. They don't actually get blood flow, and our muscles are more red because there are more blood flow through them. So the beauty of why we treat the bone and why we treat these tendinous areas is because we can actually bring a bit of fluid to it, hydration and blood. And when these white areas get that, they respond by melting and freeing up and getting rid of pain receptors. And so that's why the treatment is so effective. Oh, a bit of curry there.
So Leo, if you want to go and have a look at the muscular chart over there and show them exactly what we're talking about. So the white stuff around that knee is our fascia, or it's our connective tissue, and it plays an important role at creating stability around that knee. We need it there so we don't have instability and further injuries, but it's also can be sometimes quite compressed or dehydrated, and that can cause an inability to have range in that knee. So I'm using my elbow here, which just allows me to get a little bit more force. It saves my thumbs a bit as well as a practitioner. Got a few more patients today, and you don't want to wear out the thumbs, but just gives me another perspective of what I can feel and explore.
Heaps in there.
What's that feel like? It uncomfortable?
Just a deep ache, a little bit of sharpness to it on the outside, but no, it's more just a deep ache.
Look, obviously we can't affect the things deeper under the patella or the capsule itself, but the things we can play around with is that fascia and is that those tendons and the tissues. And as Aaron said, we rehydrate those, we create blood flow, and that could be the key to improving the range in our knee, or in our joints. You can do this sort of stuff, ankles, hips, shoulders. We're having a discussion off camera with Jace and Aaron, and I thought this was a topic on my mind on my way to work this morning, trauma versus dysfunction, and thinking about these guys here, what dysfunctions we have. I know Jason's shoulders don't move too well. Obviously Aaron's had quite a horrific injury and his knee doesn't move as well as the opposite one. So having a little bit of, a real life treatment and a real life testing of what we can play around with on camera, and show you guys what it's like to get an MMT experience of a knee treatment. How you doing, man?
What do you
feel like I need to do?
Well, I'd like just some strips all around it, just working through all these areas in here, and just explore, I guess.
Have a little bit of a fish.
Yeah, that's good in there, man. That's gold. That's awesome. That's really therapeutic.
So I can actually feel what have we got there? Like the tibia.
Yeah, it's like
top of the tib.
The crease, isn't it?
The crease.
Where the femur meets the tib.
And you can actually feel the shapes of the bones, and that's a little spot in there that sort of wedges in.
Yeah, it feels good.
Probably pierce it going deeper.
Yeah, man. Yeah, for a lot of bodyworkers out there, this is quite unique, isn't it? You don't get taught to actually push into these bony spots, but this is where people feel their pain.
Yeah. You got to go to the lengths of what your client needs. Sometimes they don't know. We know. We've done it for years. We've been practicing this for such a long time that we know that there's a lot of therapeutic treatment to be had through this area of the knee.
Yeah, that's so good. Yeah, it's the best feeling.
It's actually starting to get a little bit warmer. Jace, how's the thermometer over there, mate?
That's holding up.
He's all right.
The heater off. Yeah, I'm enjoying the sun here though. It's
Yeah.
bloody nice.
Ooh.
I'm enjoying just watching you guys work and me sit over here and
Yeah. Probably can't hear you.
probably can't.
Chase doesn't have a mic on, so he's talking.
Brand new mics.
Yeah, brand new mics.
Hopefully it's nice and clear.
Yeah.
Leo got to go to the toy store yesterday, get his upgrades.
Early Christmas present.
Take that out of his pay, will we?
So yeah, now I'm just doing a few scoops. So I don't mind if they're a little bit quicker.
No, I like that. That feels
Just
just comprehensive and
yeah.
bringing flow, bringing a bit of blood, fluid to that area.
Ooh.
A few good nuggets there, isn't there, Darcy?
Yep. So yeah, this is the meeting point of our tib and femur. You can sort of feel right there is probably where the two bones are like that, and I'm sort of working in between it. If you can see that, it's sort of like right in the gap, I reckon.
It's good. Nice.
Okay. I'm going to have a little bit of a go on the outside as well.
Yeah.
There's a nice little flicky spot there, though, that I might just sit on.
Let's see Darcy reinforcing his hands when he feels like he needs to pin it.
Yeah.
That's another little trick as a body worker, just to
Double it up.
Yeah, double it up, and you can create more force and save that one thumb, you know. It's gold.
Okay, let's have a look on the outside. I reckon can see something there, and obviously scar tissue. You can see some scarring here, some scarring there. That's going to cause some imperfections, obviously, to the skin, but also to the fascial system. So we can influence that.
Scars are still so numb. It's so
really?
interesting. Yeah, you
Yeah.
can't feel anything.
Can't feel that much. Yeah.
No. So interesting how body
Heals,
after
responds.
that,
Yeah.
How are your thumbs going, bro?
Yeah, they're feeling it.
Need to get your thumb saver in here. You got that little thing?
Yeah.
Was that just for feet, is it?
Yeah, that's a feet one.
We're going soft, haven't we?
Acupressure point or something.
Little plantar fascial goer, I reckon.
That does.
Oh, that's good.
Yeah.
That's good. That feels good.
So just a
Yes.
different style of stroke is using a broader palm. Still like using the bones in my hand to connect with the bone in his knee bone.
Got a bone in my leg.
Got bone.
We were talking about that joke the other day,
Yeah.
weren't
Yeah, that's definitely a mum gag. It's a dad gag for you, isn't it? Is
we?
that
Yeah, my
what-
granddad would be like, "Come
Grand-
play cricket with me, Pop." Nah, I got a bone in my leg. You just like, as a kid, you're like, "What? What does that mean?" And they think it's the best thing ever, eh?
Dad jokes.
That's good.
Yeah?
Yeah, I think there is some in that quaddy. Oh. Should retest as well, see if
Yeah, I might retest now. We've done some good work.
I wonder how much the old Popliteus is
Yeah,
doing it too. Definitely feels like something at the back's pretty...
you've
Jammed
retested
up.
for us the same way you did earlier. So we had a knuckle. It's probably less of a knuckle now. It's we've taken a full finger off, so we've got...
It's interesting though, the knee feels actually, it's changed, but it's like, it's gone up. It's actually
Yep.
funny.
It is in the quad?
Well, it's kind of like a lot of it's probably just like internal inflammation that stops me, and it almost feels like you've pushed it to here.
Yep.
That's so cool, actually.
I might just do a couple of broad strokes up there
Yeah.
and keep pushing it out. Yeah, no one person is the same. No one body is the same. So every treatment is different according to how they're feeling, what the movement looks like. So we're just being specific to and tailoring it to Aaron's case.
Yeah, it's good. It's this good connection with that wax, you know, like if you had oil,
Yeah.
you wouldn't be able to do this. Nice.
Did you get any treatment in Bali?
Yeah, got heaps of massages in Bali.
Yeah. What was the cheapest you paid for a massage in Bali?
I probably only went to the really cheap ones like a couple of times, but the cheapest was probably like $10.
Yeah.
I reckon. It's ridiculous, isn't it?
Yeah.
But yeah, we went to the
Paying for the
went
good
to
ones.
Yeah.
Nothing worse than you get into it and they're just flimsing around and you're like,
Well,
I've got a flower of this.
I didn't choose the Balinese style ever. I did shiatsu, so no oil, because with the oil they don't get in deep, but with shiatsu it's like through clothes and acupressure. At least they can create some friction, and it can be a bit more like our style of treatment. So, and with the Balinese one, it's such a cookie cutter thing of like you know the routine. They all learn it at the same place. But with the shiatsu, I found like there was a little bit more intuitiveness or left up to the individual with how they treat. Once you get one of the Balinese ones and you get another one, you're like, I remember this. They do 4 strokes here and then they go down here and then...
Has its place.
Nah, it's still good for getting some lymph thrown around and some blood flow.
Might help you sleep. Might be a little bit more relaxed. I don't mind getting, when you always end up sunburnt on one day and I've got to go in and you get an aloe vera
massage. One, yeah.
That's good.
Yeah, I was pretty good. I didn't get burned at all. I peeled a little bit, but...
Red light.
Didn't apply one bit of sunscreen.
Red light therapy and good diet.
Yeah.
Shouldn't need it.
Nah. Just do it in dosages. Like, you know, when you've been in the sun for 45 minutes, just go and sit in the shade for a bit, then come back out. Yeah. Like, there's people, if you sit in the sun for 8 hours, you're going to be a rock lobster.
Yeah.
Yeah.
You like rock lobster or?
Rock lobster. Oh.
Yeah. Deep quad pain.
Deep quad pain.
Let's test that. And then see where we're at. We might be Popliteus next. Again, it's also maybe how it feels. The range is still lacking, but maybe how it feels for Aaron is also an objective or a subjective measure as well. So yeah, what's that feel like?
It's the pain of it or the discomfort of it's completely changed. It almost just feels like it's just like I don't know where the block is. If anywhere, it would be top gastrocs and Popliteus. I think so.
Let's do a little bit on there. Let's just try a few minutes. See what we've got.
Here we go. Let's have a go.
Oops, he's banging the camera. Okay, so Popliteus and top of the gastroc. So I might where's our wax? Might start with just a bit of a broad stroke. So I like to palpate with the broad palm, sort of collecting the lower portion of the hammy and then going through the back of the knee into the calf. Jace just says, stop wasting your time, get straight into the Popliteus.
Don't give him anything. No.
Hurt the bastard.
Oh. Put him into next week.
In a good way.
That's a pretty Aussie saying, isn't it? Oh.
So I guess when we're talking about trauma as well, and it's in that acute phase, there actually needs to be inflammation. The body's, doing its job. It's responding by sending the blood to that area, the inflammation to guard, to protect, to prevent the range because there's an injury. So those early stages, it is okay to do some more flush type stuff and a little bit of deep work, but just knowing that you're not going to get the same results straight away, because it does need time for the body to heal and do its natural thing. Whereas with dysfunction, we're always exploring and looking for what's short and tight, what's locked, what's causing that lack of range. So that's what we're having a little bit of a go at today, is just keep looking for it, keep exploring, keep finding the point. And yeah, I guess if we're talking about dysfunction, it also might be, if we try to think of jobs that might be causing some dysfunction, there's if you were, say, a bus driver or an Uber driver and you're sitting in that position driving for 6, 7 or 8 hours, you're probably going to get some dysfunction in your shoulders, you're probably going to get some dysfunction in your hips, you're short and tight through your flexors, your pecs are short and tight, your neck's probably not in the right position, and all you're really doing is, just doing that with your foot. And you go from doing that for 6, 7, 8 hours, sometimes you might work longer, to being completely exhausted, getting home, eating dinner and tucking yourself into bed and just waiting for the next day. You do that for a life, for a long time, for an extended period of time, you're going to end up with some dysfunctions. And that's where we can, they come in and they go, I can't move my neck, I've got a wry neck, or my shoulders don't move right. They feel like they're lacking in range, and we can have a little bit of an explore and try and find what is it. And that's where we start to think about, well, it's probably, is it our serratus that's locked? Is it are we looking at subscat that's also, stuck in that position? What's stuck? What's short? What's tight? Where can we start to unravel and work? So we've always got our thinking hats on when our clients come in and they're talking to us about their pain, and we've got to go, is it a dysfunction? Is it trauma?
Good.
All right, let's have a bit.
Ooh. Yeah. Oh, yeah.
Probably feel something there.
Yeah.
So just balancing with my knee. I'm actually going to come up like that.
Yeah, that's it, right there. That's the ticket. You feel that?
Yeah.
Oh, come back on the other side of it, I reckon. Yeah, that's the one. Oh. That's it.
Aaron's got the longest legs in the world, so we're...
I was meant to be 6'9". That's what my wingspan is.
Yeah?
Yeah.
Also just didn't go with
6'9".
Torso didn't grow.
Far out.
Yeah.
I'm 5'8". I wish I was 6 foot.
What are you actually done? Probably made with some extra on.
5'6". Nah, I'm 5'8".
5'8" with your high heels on.
172. What are you, 174?
Yeah, something like that. 175, I reckon.
Bastard. What are you, Aaron, 195?
I think so, right? Roughly like that. Maybe just under it.
Could have been midfielder these days, Aaron.
Yeah, Paddy Cripps. Oi. Ah. I'm a boo-boo. Oh.
So I'm sort of hugging and locking that leg. If I was a bit flimsy with it, Aaron I can already start to feel him catching himself and trying to hold his leg up. Whereas if I'm more supportive and locking that in, it's just he can completely relax and know that it's safe for me to explore and treat. Whereas if you're not really supportive with your other hand, they're not feeling the support and they're probably not going to completely relax into it.
Oh, it's so good.
Tricks of the trade.
It's good. I've needed this. This is it. Here it is.
Here it is. We're on to it. Come on.
A few good games of footy this weekend. Oh, tonight, it's a ripper. Yes, yeah. See those gastroc heads. I reckon Popliteus is the main one, but
Gastroc head.
ooh.
Do the Tillies beat France on Saturday night, as?
I hope so. Well, it would be beautiful, wouldn't it? If that happened.
What are they ranked? 3rd or 4th?
France? I'm not sure. We're not favourites, but the girls are playing well. They look so good against Denmark. Talking about the Women's World Cup.
Women's World Cup.
At the moment. Soccer. One of the biggest sporting events to ever happen in our country.
Yeah. Who would have thought?
Crazy. Oh, that's so amazingly good, Darcy. Yeah, that feels fantastic. Oh, that is so good. What's if you just that is actually terribly relieving. Oh my gosh, it's one of the best popliteal strokes you've just invented there.
Yeah,
it's incredible.
I can just feel some thickening or something solid in there, so that's why I'm just sticking on that.
Yeah, this is a great technique, man. Yeah, so for all you playing at home over there. Popliteus is, whenever you have any trauma to the knee, it creates stability. So anytime you have an injury, there's some form of atrophy, which is a weakness. So the body switches things on to kind of compensate for weakness, and Popliteus is one of the main ones with the knee. And it's also an inhibitor of your quad. So when you get an injury to the knee, generally your quads can kind of switch off, and the Popliteus switches on. And that can be the dysfunction. You've got to unwind that popliteal tension and then get that quad back online to protect the knee, to give it some security and stability and things like that. So that's what I think I've got a lot of, since my knee doesn't really give me much grief anymore, but if it does, that's the pattern I think that comes up. Popliteus gets a bit too switched on and my quads go offline. So that's what Darcy was talking about before, about trying to find those relationships when people come in.
Yep. Awesome. All right, let's have a little bit of a retest.
Oh.
See how we're feeling. Flip over on your back. Get rid of the towel, we don't need that.
Flip. Oh. Okay. Let's have a gaze.
Let's have a bit of a feel.
Oh, that's so much better.
Feels good?
That feels the best, yeah. And I feel like I can force it.
You can almost get there, man.
Yeah. So I feel like I can force it now, whereas before I couldn't.
Yeah.
It felt like a guarded thing. So.
Yeah, there was something blocking there. Well, that's a knee treatment, fully comprehensive, just having a little bit of an explore, play around with.
The back was stopping the front.
Yeah, so the Popliteus, as he said, it was a surrogate for some instability in that knee. It's short and tight because there was instability in there, but it's also inhibiting the quad. So that's stopping that knee flexion. So we get in there, we release that, and it has an effect on the front of the knee, and we can allow that flexion in that knee. So yeah, if we went there first, maybe it would have fixed it. Maybe it needed the stuff through the front as well.
Correct.
It was cool to just show how we treat the bones, the ligaments, and the tendons that attach into that knee. So yeah, if you've got knee pain, make sure you go to our website, book in online, see one of our practitioners, and we can fix you up. Thanks for watching.
Thanks, guys. Thanks, Darcy.
Done.
Beautiful.